Hello everyone. So today's topic is development of nasal cavity and development of palate. So at the end of the session you should be able to describe development of nasal cavity and palate and what are the developmental basis of congenital anomalies of face, specifically related to the nasal cavity and palate. First, here we see what happens after formation of head fold. So here you see this is the head fold. So after formation of the head fold, you are able to see there are two prominent bulging on the ventral aspect. Okay, so there is developing brain here and there is pericardium here, and here is septum transversum. You can see the pharyngeal arches, you can see the foregut, midgut and hindgut. Okay, so this is the pericardial bulge. If you see here, so there is the bulge produced by developing brain, and here it is the pericardial bulge. So between the bulge produced by the developing brain, okay, and the pericardial bulge, there is stomodium. Stomodium is future mouth. Now if you see here, the floor of the stomodium is formed by the buccopharyngeal membrane. Okay, and here if you see this one, stomodium is separated from the foregut. Here is the foregut. Okay, then there is frontonasal process. So here mesoderm covering the developing forebrain, it is downward projecting. You can see here it is a downward projecting and it is overlapping the upper part of the stomodium, and this mesoderm which is covering the developing forebrain is known as frontonasal process. So now here you see the frontonasal process is here, and we are able to see here the pharyngeal arches. Now pharyngeal arches, you can see the first pharyngeal arch, second pharyngeal arch, third pharyngeal arch, fourth pharyngeal arch and sixth pharyngeal arch. Okay, so the pharyngeal arches are present here. You can see the first pharyngeal arch has two parts, the maxillary process and mandibular process. Okay, so here you can see the single pharyngeal arch, here you can see the two part of the first pharyngeal arch. Okay, so face is derived from the frontonasal process. Where is frontonasal process? Here is the frontonasal process, which is nothing but the mesoderm covering the developing brain. Okay, and so if you see here, this part is, here you can see the frontonasal process and there is the first pharyngeal arch. They are combinedly going to form the face. Okay, so now each mandibular arch or first pharyngeal arch, can you see here, this is the first pharyngeal arch. It has two process, that is the maxillary process and this is the mandibular process. Now what is nasal placard? So nasal placards are bilateral localized thickening from the ectoderm overlying the frontonasal process. So here is nasal placard, here is nasal placard, and it is situated above the stomodium. So here is stomodium, this is first pharyngeal arch having maxillary process, mandibular process, and this is nasal placard. Okay, so now this nasal placard will sink below the surface to form the nasal pit. Now here you can see this nasal pit, okay, formed due to sinking of the nasal placards, and it is continuous with the stomodium. Now edges of the each pit raised above, so medially it is known as medial nasal process and laterally it is known as lateral nasal process. So you had first nasal placard, I have shown you, then there was this nasal pit, and now on either sides you can see the medial raised edge, that is known as medial nasal process, and laterally there is lateral nasal process. You can see the maxillary process and the mandibular process from the first pharyngeal arch. So the summary here, if you see the structure which are forming the face, you can see here the mesenchyme, here you are calling that as frontonasal process. You can see the first arch, you can see the process from the first arch, maxillary and mandibular. You can see here the nasal placard, and here is the medial and lateral nasal process, and there is the nasal pit. Okay, so these are the structure: frontonasal process, maxillary process and mandibular process. All together they are going to form the face. Okay, now we are going to see here the development of nose. Okay, so the development of external nose. External nose is derived from the 5 facial process. First there is frontonasal process. So here is the frontonasal process. Then 2 medial nasal process, 2 lateral nasal process. So you can see here, if we see the lateral view, nasal cavity is developed from the ectodermal nasal pit. So nasal pit is deepening during the 6th week of intrauterine life to form the nasal sac here. Okay, each nasal sac grows dorsoventrally to developing forebrain. Here is the developing forebrain to form the primitive nasal cavity. Now you can see here, this is the primitive nasal cavity, and here is the primitive oropharynx, and this is the primitive oral cavity. And there is a partition between the primitive nasal cavity and primitive oral cavity, that is known as oronasal membrane. Okay, so dorsal end of primitive nasal cavity is separated from the oral cavity by oronasal membrane, and here there is stomodium. Okay, so nasal pit, there is stomodium, there is the future mouth or primitive oral cavity. Okay, now what happened at the end of 6th week? The oronasal membrane rupture to form primitive choana. That means here you see, this is the primitive nasal cavity, here is the primitive oral cavity, and there is the rupture of oronasal membrane. So this communication is there between the primitive nasal cavity and primitive oral cavity. So this is known as primitive choana, and this is the direction. Here continuity is there. Okay, primitive choana lies at the junction of primitive nasal and oral cavities immediately behind the primary palate. Okay, we will see what is primary palate. Later what happened, there is further growth of the primitive nasal cavity. Okay, that is now known as a definitive nasal cavity because of formation of secondary palate. So you can see here, this is primitive palate, this is secondary palate, and you can see now the communication between the definitive nasal cavity with the part of the pharynx situated behind the nasal cavity. So this is now known as the nasopharynx, and this communication here is known as the definitive choana. Previously we saw primitive choana, this is definitive choana. So definitive choana lying at the junction of nasal cavity and nasopharynx. Okay, now here if you see, the external opening of nasal persisting as external layers. So here is the external layers, and there is development of superior, middle and inferior nasal concha, which are curved elevation from the lateral wall of nasal cavity. Okay, so here ossification will happen. So there will be the superior, middle and nasal concha. Okay, so and if you see here in the upper part of the roof of the nasal cavity, the epithelium here will be specialized, which is now known as olfactory epithelium, and which will provide origin to the olfactory nerves. So what structure you are able to see? There was, this is primitive palate, this is secondary palate, this is definitive nasal cavity. Okay, and here is communication between the nasal cavity and nasopharynx, that is known as definitive choana. Okay, and here is oral cavity. Behind the oral cavity, here is oropharynx. So if you want to see the summary of the development of various component of nose, so dorsum and the tip of the nose coming from frontonasal process, nasal cavity is coming from the nasal sac formed by the elongation of nasal pit, nasal septum is also coming from frontonasal process, nostrils, that is anterior nares coming from nasal pit, and choana or posterior nares coming from rupture of oronasal membrane in second month of intrauterine life. And this can be MCQ question. Okay, now what is intermaxillary segment of face? So here you see, this is the maxillary process of the first pharyngeal arch. Okay, so these two here maxillary process, they will be growing medially, and here is the medial nasal process. Remember, so two medial nasal process fuse to form. Okay, with the two medial nasal process will be fusing to form here along with the maxillary process, and they will be forming intermaxillary segment of face. So intermaxillary segment of face consists of three components. There is something known as a labial component, which is forming the philtrum of upper lip. There is upper jaw component here, this one, which is the coming from the alveolar process of maxilla and which has 4 incisor teeth. And then there is palatal component, which is forming the primary palate, also known as premaxilla. So all these three things, okay, the philtrum of upper lip, alveolar process of upper jaw, and premaxilla, all the three are coming from the intermaxillary segment of face. Okay, now we will see the development of palate. So embryologically, palate consists of two parts. There is something known as primary palate and secondary palate. Primary palate develop from the frontonasal process. Remember, in previous slide I have shown you there is something known as intermaxillary segment, and which is giving the primary palate, and secondary palate is coming from the maxillary process. Development of palate begins in 6th week and it is completed by end of 12th week. Palate is developing in two stages. First development of primary palate and then development of secondary palate. So you remember this, here was the primitive nasal cavity, there was the primitive oral cavity, and here was appearance of primitive palate. I told you already, primitive palate is coming from the intermaxillary segment. Okay, so the primary palate is formed by fusion of two medial nasal process. You can see here two medial nasal process are fusing, they are forming the intermaxillary segment, and from this intermaxillary segment three components have come: philtrum of the upper lip, alveolar process of upper jaw, and premaxilla. Okay, this is also known as primary palate. Okay, so the primary palate is formed by fusion of two medial nasal process. It is a wedge-shaped mass, okay, of mesenchyme at the deeper level, and it is opposite the upper jaw carrying the 4 incisors. It is ossifying to form premaxilla. Okay, then the development of secondary palate. We have already seen here is premaxilla, which is coming from intermaxillary segment. Okay, so the secondary palate is part of the definitive palate. It is formed by fusion of two palatine shelf. So you can see here is one palatine shelf and here is another palatine shelf. These two palatine shelves are shelf-like outgrowth from the inner aspect of maxillary process. So here is maxillary process. So from here these palatine shelf are moving towards each other. By 6th week palatine shelf appears. They initially grow downward and medially on each side and above the tongue, and by 7th and 8th week they assume horizontal position above the tongue, and then they fuse to form the secondary palate. You are seeing here how the secondary palate is formed. So secondary palate is primordium of the most of the hard palate and whole of the soft part of the adult palate. So you can see here, this part we have already discussed. This is primitive palate coming from the intermaxillary segment, and this remaining part is the secondary palate, which is coming from here, fusion of the palatine shelf. So ossification will be extending from the maxilla and palatine bones into these shelf. So now here the posterior part which is extending beyond the nasal septum, and here ossification does not happen. That will be forming the soft palate here, and also uvula, the posterior most part of the palate. Okay, now you see here the secondary palate is this one, which is coming from the maxillary process. From maxillary process, okay, here the secondary palate came, it has formed hard palate and soft palate. So now here a Y-shaped suture is present between the primary palate and the secondary palate. Okay, so each limb of Y, okay, this one and this one, passing between the lateral incisor and canine teeth, and junction between the primitive and secondary palate represented in adult by incisive fossa. So here will be the location of incisive fossa, which is opening into two incisive foramina. Okay, now how the permanent palate is formed, we have seen here how the two palatal shelf are fusing with each other, forming the most of the part of the hard palate and also complete of the soft palate. Okay, now here we are seeing this is the two palatine shelf are going towards each other, and they have fused here. At the same time, what happens, the developing nasal septum, okay, which is arising from the frontonasal process, it grows down and joins the superior aspect of the anterior 3/4 of hard palate in midline. Okay, by 9th week, fusion between the nasal septum and secondary palate begins anteriorly. So anteriorly the fusion will begin, and by 12th week the fusion of the developing nasal septum with the secondary palate will be completed posteriorly. So you can see here, this is the primary palate, here is the secondary palate, and here is the developing nasal septum will be there, which will be fusing here with the hard palate. Okay, so anterior 3/4 of the permanent palate, anterior 3/4 of the permanent palate. Permanent palate means secondary palate is ossifies membrane and it is forming the hard palate. Posterior 1/4 of the permanent palate or secondary palate, here this part which will be failing to join with the nasal septum, there will not be ossification also, and it will be forming soft palate along with the uvula. So soft palate hangs as a curtain to form the posterior margin of hard palate. So you can see here the frontonasal process is forming the intermaxillary segment, which is forming the primary palate, or we can say premaxilla. Maxillary process is forming the secondary palate, and from here there is formation of hard palate and soft palate. So the summary of development of adult palate: hard palate in front of incisive fossa. So it is known as premaxilla, where there will be 4 incisor teeth. It is formed by the fused medial nasal process of the frontonasal process, and behind the incisive fossa. We are talking about the hard palate. It is because of fusion of palatine shelves of the maxillary process of two sides. Soft palate, it is unossified part of the fused palatine shelf of maxillary process, and they are extending posteriorly beyond nasal septum. Okay, so that is the summary of development of palate. Okay, what is the applied anatomy? So applied anatomy, what is applied anatomy of the development of the face? Whatever defect can occur in face, same can extend to the palate also. So here is the hair lip deformity, that is upper lip. Okay, so this is the cleft lip, which can extend as cleft palate also. So there can be midline defect of upper lip. Okay, there can be lower lip defect, but which is not related with the palate. Okay, so you can see oblique facial cleft. Okay, that is more of deformity of the lip, but it can involve palate also. Then there are few syndrome, there is which are related to the first arch. First one is Treacher-Collins syndrome or mandibulofacial dysostosis. Here there might be mandibular hypoplasia, okay, but lesser involvement of the maxillary process, okay. Then there is Pierre-Robin syndrome. It is autosomal recessive disorder, and here there can be cleft palate also, okay. So here is today's topic. You can see here another syndrome, that is DiGeorge syndrome, okay. So it involves many features, okay. So this also involves the first arch, okay. So that is